Hi, today I'm going to be discussing the coronavirus outbreak and some of the conversations that I had through work and with family about the outbreak over spring break. As someone who works in healthcare, I find it so important for us to have an understanding of the virus, but also to be able to have the critical conversations of how we can improve our healthcare system and better ourselves as a community. Over break, I attended several virtual lectures with several of my coworkers to discuss the importance of protecting our hospital and our community. One thing that was discussed at length was how we can protect our patients by minimizing foot traffic through the hospital and only allowing necessary people to enter the building. By doing so, we limit the amount of spread of germs and the possibility of an infected individual coming into contact with someone who is susceptible. One conversation that really stood out to me was one that I had with my sister, who is an ER nurse at a small rural hospital. She voiced many concerns about how the hospital wasn't regulating who could come in and out and the number of testing that they were doing for people who didn't even have the symptoms, which is something that was unfamiliar to me because Gritman has done so few testing because they will only test people with all of the symptoms. It was nice and enlightening to be able to get a different perspective from someone who works in a different area of a hospital. One conversation that was especially meaningful to me was one that I had with my grandparents. Over spring break, I was supposed to travel to Scottsdale, Arizona to go spend several days with them. Both of my grandparents are in their mid-80s and have underlying health conditions, so I thought it was out of their best interest and my best interest to postpone my travel plans until a later date to help protect them and their neighbors. They live in a community full of many susceptible individuals, and so it was important to be able to have a conversation with them about the importance of social distancing and how the virus is spreading. My grandparents didn't have much information on the virus, so it was nice to be able to spread some of the knowledge that I've learned with them that I got from school and from the hospital.